treatment of pyelonephritis due to retention or causing sepsis. Whenever renal retention is diagnosed, the relief of this constitutes the first step in the treatment of any renal infection, acute or chronic, mild or severe. The general topic of renal retention is discussed under the head of hydronephrosis, but renal retention is often silent until infection produces symptoms. The following observations may prove suggestive in the treatment of such cases. In children, the relief of renal retention is accomplished by postural exercises as already described. So long as there is no stone, gross dilatation of the kidney is not likely to be found excepting in rapidly fatal congenital cases. In pregnancy, decubitus with a pillow under the lower chest may relieve pressure in pregnancy. If this fails, drainage should be obtained by the indwelling ureter catheter. It is scarcely ever necessary either to perform nephrectomy for a fulminating condition, I have performed one such, or to terminate the pregnancy. Patient and intelligent care, and above all, an early recognition of the fact that the patient's albuminuria is due to retention and infection and not to Bright's disease, should carry her through her pregnancy safely. Urethral retention. This is a common cause of renal infection. The treatment of the various types of urethral retention need not be specified here. One must not forget, however, that a virgin may have retention of urine due to cystocele, that this condition is very common in old women, and that stricture of the urethra is very commonly overlooked in women. The fact that a glass catheter will enter the bladder by no means shows that the woman has not a stricture. Her urethra should normally take a 24 to 26 sound. It is most essential to remember that a primary cause of retention in the urethra or lower ureter may so dilate the canal above as to cause secondary kinking and pouching of the upper ureter and kidney pelvis. Under such circumstances, the relief of the lower retention does not accomplish a cure. One sees this commonly in cases of pyelonephrosis due to urethral stricture or prostatism, the pyelonephrosis being kept up by a ureteral kink after the urethral retention has been relieved. Stricture at the ureter orifice or stone impacted for a long time in the lower ureter has a similar effect in some instances. Nephropexy may cure infection due to slight retention. Pyelography and careful examination of the kidney, pelvis, and ureter for kinks, adhesions, and dilatations in the course of the operation will reveal the precise condition in many such cases.